I'm not going to introduce you because I'm going to let you introduce yourself.
Mm-hmm.
But we've got a good topic today that we're going to be speaking about. Thanks very much for coming on.
Thank you for having me.
No problem. It's an honor. You and I, we have a lot of deep conversations every Christmas and Easter. It's like a tradition of ours now. And one of the reasons why I wanted to get you on is because whenever we get into these deep discussions, I always say to myself, man, people would love to hear what we're talking about right now. So, welcome and thanks again. So, you're a psychologist.
Yes.
Yeah. Do you want to start with why?
Absolutely. So I'm a child and adolescent psychologist. So I'm a registered psychologist.
Yeah.
Specifically working with children and adolescents. I work with children, adolescents up to the age of 18. And the reason being was I went through my own hardships earlier on in my life, specifically around when I was an adolescent.
Around what age roughly? Not to get into too much detail.
Yeah, absolutely. How old are we in year 11?
Year 11 about 16.
Sure.
Yeah.
We all know how much the pressures of HSC, performing,
so was that? Yeah.
Getting into university was.
Yeah.
So around that time, obviously the pressures coming from a Middle Eastern family.
Yep.
Were paramount. We wanted to go to university, make our parents proud.
Yep.
And I was performing pretty well until I ran in with a teacher.
Yep.
During my, again, 11 and 12.
Yep.
And during that time, let's say we didn't say eye to eye. We didn't see eye to eye. And that led me to the way his teaching approach wasn't the best.
Yep.
And that led to deterioration to my performance academically. So
overall or just in that one subject?
Eventually it was global. Like it was right across so many things.
Yep.
So I'd present to school pretty anxious. Now at the time I didn't know what anxiety was.
Wow.
So I'd go to school, performing pretty decently. Like we weren't doing too bad at school. And then we ran into this teacher, and because of the anxiety, I couldn't perform anymore. I started flunking maths, flunking English. Now we've gone from not necessarily a top 5, but definitely a top 10, top 15 student.
Yeah.
And then that anxiety there at the time, which I didn't know, started leading to my depression. And I was like, why? These internal thoughts started coming around. It's like, why am I failing? I'm a failure. I'm not good at this. I'm making my parents, I'm disappointing my parents.
Yeah.
And so this vicious cycle of anxiety and depression started coming about.
Yeah.
I remember this morning, my mum waking me up. Now I was physically healthy. There wasn't no issues physically. I remember this so clearly. My mum tells me, "Get up. What's wrong? I'm finding like it's very hard for you to get up in the morning. You're physically healthy, but there's something wrong." And I was like, "She's right. What's going on?" So we went to my GP. And I was like, maybe there's something physically that's a little bit different. Now again, Arab household, we didn't know what mental health issues were.
Yep.
And then I started telling my symptoms to my doctor, and he goes to me, "Do you know what anxiety is? Do you know what depression was?" And he was sort of speaking like a foreign language to me. I'm like, what are these?
Yep.
And then from there, he sent me off to a psychologist, obviously explaining what it is and what it's all about.
Yep.
Sent me off to a psychologist. Saw him for a little bit.
Yep.
And from there, I was able to, again, change the thoughts in my mind. The trajectory of, coming back and doing the HSC and whatnot went well.
So he helped?
He helped.
Yep.
He helped.
Were you inspired by him at all? Like, did you...
I was, I was inspired by the teacher.
Okay.
Yeah, the teacher that brought these sort of things on me.
Those negative thoughts on
absolutely.
you? Wow.
And the reason being was because at the time, I felt like I was alone. No one understood what was going on.
Yeah.
And so thank you for Mr. X.
Yep.
He put this in my mind, and I'm like, if there's anybody in this world that's going to help children, adolescents going through the same things I was going through in my life right now, I want to be that person.
Okay. And when did that thought cross your mind?
Absolutely. When we were putting the
wow. So when you're studying for your HSC and you want to get good marks, did you have a profession in mind at the time?
Yeah, at the time I wanted to be a pilot, a
pilot.
vet.
Wow.
Yeah,
okay.
yeah. And then after that whole experience, it was literally a last minute change.
Wow.
I put it on top.
And how long would you say that experience was from when you got referred from the GP to when you started seeing the therapist or the psychologist until when you ended that time with him? How long was it? Was it 6 months? Was it a year? Was it?
Good question. Good question. At the time, I know it was probably 4 to 5 sessions.
Okay.
4 to 5 sessions. It was a combination of cognitive behavioral therapy, so working on my behaviors, working on my thoughts, and putting in a proper structure around homework, how this person or how Mr. X was treating me.
Mm-hmm.
And then we'll probably talk about this a little bit later on.
Yep.
But then therapy started to seep into my schooling life, where we're putting strategies into place to make sure that I was okay in the classroom and whatnot.
Okay.
Yeah.
And that'll help.
Mm-hmm.
All right, awesome. So then that inspired you, and then afterwards you thought to yourself, you know what, I want to actually do the same. But the field that you're in now, you don't just deal with adolescents though, do you? You deal with like children as young as 3, 4?
Yeah, children as young as 3.
Yeah. Wow, what's that like?
So children as young as 3, I'm not obviously sitting down and talking to them about their past traumas and whatnot. We're having a tea.
Right. Yeah, because you're telling me like it's very different to like
it is
how you speak to adults, for example.
Absolutely. Children are more play-based.
Yeah.
And so depending on the diagnosis, generally it's children on the spectrum, for example, they're just coming through with inquiries and investigations as to what's going on.
Okay.
And it's working very closely, first and foremost, with the parents.
Yeah.
And then also working with the child. Yeah.
Yeah. Okay, awesome. And when it comes to children, okay, I know that people, when they speak, they don't really look to data or research. It's kind of like more sentiment and feelings, but people feel like that children are like, there are a lot of children that are presenting with, like, for example, anxiety or depression or so on and so forth. What are some common problems or diagnoses that you see coming in?
Yeah, it's a very, very good question. Common diagnoses. What I want to talk about is something that can, obviously for the viewers, and they can understand.
Yeah.
In a way that a lot of people can relate to. And one of the big things, for example, is the relationship with parents and children.
Yeah.
Now, whether that be how they treat them, how they care for their emotional needs. Anxiety and depression, for example, can be interlinked with parent attachment, right? And so more often than not, before even touching therapy, for example, common problems, for example, aren't necessarily always psychological. But before touching anything psychological, I always assess 3 things.
Yeah.
How's your child sleep? How's their exercise? How's their eating? More often than not.
Wow.
One of them is
lacking, or all of them?
Well, it could be all of them. It could be 1 of 3. It could be 2 out of 3.
Yeah, because I'm a high school teacher, or I was a high school teacher, and lack of sleep becomes a big deal around year 10, year 11, especially with kids who've got like no control over, like, for example, technology, taking their laptops into their rooms and things like that.
Sure.
You can almost tell at 2 o'clock, 1 o'clock, 2 o'clock during the day when you see those kids that are falling asleep. It's either it's either the lesson that you're presenting is boring, which can't always be the case.
Sure.
But it's usually because of lack of sleep.
Absolutely.
You know? And then when you ask them, like, sometimes I even joke around with them about the fact that they game or they're up late. They don't deny it. You know. So are you saying that this is also the case with kids, with children?
Yeah. Look, adolescents have the sort of sticky end of the stick in that naturally their circadian rhythms and the way they want to sleep are shifted. Yeah. So they want to go to sleep a little bit later and wake up a little bit later. Yeah. Unfortunately, our society isn't catered for that sort of sleep schedule. They have to be awake at a certain time. So it's
funny. Yeah, keep going.
It's partly neurological.
So you're saying it. Okay. So you're saying that biologically or evolutionary, like when kids reach adolescence, their circadian rhythm, it kind of shifts so that it's more natural for them to want to sleep later.
Yes. Yeah.
Okay.
Yeah. So they want to sleep a little bit later.
Yeah.
And wake up a little bit later.
And because I know other societies or cultures where they actually accommodate for that. So, for example, or I don't know whether it's now, but my mum always used to tell me that in Chile, where she grew up, you had the option to either go to school in the morning from 7 to 3 or 7 to 2, 7:30 to 2:30, or you could have gone to school from 12 to 5 or 12 to 6, depending on whether you're a morning or an afternoon person. And so my mum, she was more of a morning person. She used to go to school in the morning. This is once they reached adolescence, like high school.
Sure.
Yeah. But my uncle, he liked going to school in the afternoon. So it's funny that like you mentioned that because
now it's not like a one shoe fits all, right?
Sorry, yeah, that's right.
Yeah. So naturally, there's people who want to wake up early in the morning.
Yep.
There's people who want to wake up just in the morning, and then there's people who want to sleep in a little bit throughout the day.
Yep.
You're not one or the other.
Okay.
Yeah.
Yeah, that's awesome. With these, so you're saying, so you assess.
Yep.
When it comes to these children, you assess how okay. But once they get the sleep, the diet, and the exercise sorted out, is it a certain percentage like of them? Like, is it like over 50%?
Not necessarily. I can't put like a specific number on it.
Okay.
But these, before touching psychological therapy,
Yeah.
these are the three things that I generally assess. Now, they're not the only things that I assess, but more often than not, these are the things that I do assess.
So when it comes to your method and how you assess,
not necessarily my method, but
the
best
method.
practice.
That's
because it all feeds into each other, right?
Okay.
Lack of sleep is associated with more irritability, for example, increase in anxiety. You don't have to go so far. Matthew Walker, who's a sleep expert, Why We Sleep is one of his books, absolutely describes the detriments associated with lack of sleep.
And what's his definition of lack of sleep?
In the book, he references anything less than, the recommended is 8 hours.
Yep.
Anything less than 6.
Okay.
The studies that he was showing in the books, I can't quote them at the top of my head.
Anything less than 6. Okay.
Now,
and what about does he talk about the quality of the sleep as well?
Absolutely.
Okay.
Absolutely.
Because I got a sleep app. Yeah, because I was, I don't know, I was just really conscious of the fact that I was actually like, I wasn't having quality sleep, you know? And those sleep apps, they tell you like whether you're in a state of deep sleep or you're in light sleep, or you've got there was a term for it called rapid eye movement or something like that, REM.
REM sleep.
I don't know, maybe you can touch, maybe you know a little bit more than about that.
Sure.
But I think you're supposed to be getting at least 1 or 2 hours of like deep sleep.
So duration, for example, of sleep is important.
Yeah.
Again, the quality of sleep is also important.
Yep.
Hence the reason why sleep apnea, for example, is like massive in our society. But that's also associated.
And when you're
with
saying our society, are you saying in Australia?
Yeah. And mainly referencing from Matthew Walker's book a little bit.
Okay. Is he Australian?
No, he's American.
He's American. Okay.
Yeah, from the top of my head.
Okay.
Yeah. But yeah, definitely the quality of sleep is very important too. Just because you're getting 10 hours or 6 hours or 8 hours doesn't necessarily mean you're getting the best sleep.
Okay. All right, cool. And so let's you mentioned a couple of things, like for example anxiety, depression, and I wanted to know, especially for our audience, because I know we throw these terms around a lot, but we a lot of us, including myself, don't actually know what they mean. What is the definition, or how would you define some of these terms like anxiety and depression?
It's a really good question.
Yeah.
First and foremost, let's start from the top. We all need to have a sense of fear. We all need to have a sense of sadness.
Yeah.
It's when these things become pathological in that it's impacting our social lives, our academic lives, our occupations. That's when that fear becomes impeding everyday living. Yeah. And so it stops me from going to work. It stops me from going out in social settings.
Yeah.
It stops me from speaking in certain situations. Yeah. So it's impeding my everyday life.
Wow.
And so we manifest that, or more so or less, in a way that's digestible. That's anxiety. Obviously, it's associated with symptoms. For those that want to look it up, it's in the DSM.
Yeah,
which is like sort of our
diagnostic statistic manual.
Yeah, yep. Or the psychiatry.
Is that kind of like your Bible? Is that like the Bible for psychologists?
It's exactly what it is.
It always keeps getting revised.
Yeah, yeah. We just went through a recent revision too.
Okay. What version are you up to now?
It's still the 5.
5.
Yeah,
okay.
And so that revision there, But you need to meet a certain amount there's a criteria for anxiety.
Okay.
And depression.
Yep.
And you need to meet a certain amount of criteria, or out of the criteria. So maybe it was like, I can't remember off the top of my head again.
Yep.
But 6 out of the 9, for example.
Okay.
And that,
And so could you tell me some of those criteria?
Yeah, irritability, lack of sleep.
Irritability at anything? Because like, can someone's temperament be naturally prone to irritability?
Sure.
Like just someone that just gets annoyed at everything, regardless?
Mm-hmm.
Or is that a signal that this person could be suffering from anxiety?
Sure. Now it's very difficult again to answer that question, because it's on a base, like it's a person by person situation.
Okay, yeah.
Right?
Yep.
The big thing that you want to be looking at is it impacting their social, academic and occupational life?
Okay.
So if like irritability is becoming a problem,
Mm-hmm.
it doesn't necessarily have to be associated with anxiety. It could be associated with so many other things, for example.
Yep.
Yeah. So those are a couple of things for anxiety.
Yep.
Depression can be anhedonia, which is a fancy word for not enjoying the things that you used to enjoy. So people who are depressed, for example, don't enjoy the things that they like.
That they enjoyed when they didn't have depression.
Sure.
For example. Okay.
Sure.
Is depression more deep-seated?
In what way?
In a way that it can really debilitate somebody, like more so than what anxiety can, or can they both pretty much do the...
Yeah, absolutely.
Can they both debilitate a person?
Yes, yeah.
Like stop them from going outside, for example, stop them from socializing?
Definitely.
Okay.
Definitely.
So
and they're generally comorbid.
Sorry?
They're generally comorbid, which you generally see anxiety, like primary diagnosis could be anxiety.
Yep.
And then the secondary diagnosis could be depression.
Okay.
So I'm anxious about going out.
Yep.
And I don't see my friends.
Yep.
So sorry. I'm anxious about going out.
Yeah.
And that results in me not seeing my friends. So there's social withdrawal.
Yeah.
And I'm depressed about that. But then it feeds into itself, and it's like, okay, I want to go out and see my friends now.
Yep.
But guess what? I'm anxious. And so I don't go out.
Okay.
And then...
So they feed off each other?
Yeah. In some situations, right?
Okay.
So in for example, in some people you can have both. In some people you can have one. And
So you can have people, for example, like that are just depressed and not anxious.
Sure.
And people that are anxious and not depressed.
Sure.
So can you give me an example so that I'm not confused?
Mm-hmm. Mm-hmm.
What would a person look like? I know that you probably won't like to generalize, but just give me a particular case in which a person would be depressed but not anxious. Just depressed.
Sure. Losing their job.
Okay.
Losing a loved one.
Okay.
Okay. Losing a friend.
Yep.
Losing a relationship.
Yep.
That doesn't necessarily mean just because I've lost a relationship, I'm anxious to go out and seek one.
Yep.
It just means that I'm
okay.
depressed about losing.
Yeah, because I've read a book on depression.
Mm-hmm. Mm-hmm.
It's by a Catholic psychologist, Aaron Kayarati or something, I think his name is, and he speaks about grief and the loss of a loved one as being a very big catalyst for depression in people, especially like people that he was seeing.
Mm-hmm. Mm-hmm.
Is that usually the case? Or but when you deal with children, can children be depressed from?
Yeah, absolutely. Absolutely. Again, it's very important when we're having this conversation that it's normal to have these feelings. If we're losing a friend, it's very normal to feel sad.
Yep.
It's, for example, part of the DSM for grief is when it becomes not necessarily... You have to be... Grief, it's complex, right?
Yep.
But part of the criteria is that you have to be... If you're grieving more than a year...
Yep.
Now, this is not... Again, I'm going to reiterate throughout this.
Yep.
It's that it's very... Not necessarily subjective.
Yep.
But it's important that... When I'm saying
case by case.
It's a case by case.
Yep.
But if we're doing it over a year...
Yep.
It's becoming an issue. Now, obviously, there's criteria associated with that.
Yep.
But if a loved one's passed away and after a year, we haven't been able to put ourselves together in whatever way that might look like.
Yep.
If I can't go to my job because I'm still grieving.
Yep.
My relationships are deteriorating because of the grief. Do you see how now that grief is impacting different parts of my life?
And so that's the definition of how it would become pathological. Is that right?
Sure.
Okay.
Sure. Yeah. in one way.
Okay,
Absolutely.
awesome. And so when with children as well, other than the anxiety and the depression, another thing, common diagnosis that people are talking about now is autism. Can you speak about that? Like, what is autism?
So, working with children and adolescents,
yeah,
there's a variety of diagnoses that I work with: anxiety disorders,
yeah,
depressive disorders,
yeah.
Autism falls under neurodevelopmental disorders,
Okay.
and that's in part what autism is. It's a spectrum.
Yeah.
And there's two theories as to what's going on inside the brain. First and foremost, it's perhaps how the brain is communicating with itself, whether it's through neurons, for example. There could be difficulties with the communication between different parts of the brain, the sizes of different parts of the brain, and whether those parts of the brain, for example, are inhibited. So they're there, they're just not as active as they should be.
Okay.
And so depending on what part of the brain is affected, presents in a certain way.
Okay.
And so autism, hence it's a spectrum.
Yeah.
Now, I don't want you to think about autism as a linear spectrum. It's more like of a hexagon.
Okay.
Based on so many things, right?
Yep.
Special interests and whatnot.
Yep.
And then that's why children who are on the spectrum present in so many different ways.
Okay.
But what it is, it's a neurodevelopmental disorder.
Yep.
That impacts, again, everyday living. Yeah.
Now, with autism, though, because I find autism like extremely interesting, and again, it's a generalization, but is there a common thread amongst all children who have autism? Because can it, like, if a person, if a child, for example, presents himself or herself to you, are you able to tell within the first 5 seconds that they've got autism, for example?
It's a brilliant question.
Yeah.
Sometimes, yes.
Yeah.
Sometimes we need a whole array of a team coming along together to make sure that we're getting the
correct diagnosis?
Yeah, correct.
Okay.
Correct. So it's not very clear cut.
Yep.
Just like anxiety, depression.
Yep.
You know, on paper, it can look like, hey, X person is presenting with these symptoms.
Yep.
Hence the reason why we can match it up with the diagnosis.
Yep.
But then when we look at the commentary and as to what's going on, it's like, oh, hang on a second, that might be something else.
Okay.
And so that's why it's difficult to give you a very direct answer.
All right.
Yeah. Yeah.
But if you were to say probably the most common thing that you noticed about children that are autistic or that have autism, what would you say it is?
Yeah. So with children on the spectrum, God bless them, absolutely love working with them. There's never a day the same working with children with autism. Perhaps their special interests.
Yeah.
You know, their ability to play. So it's not the way that children that are not on the spectrum play. Yep. You know what I mean?
Yep.
So the foundations of play are a little bit difficult.
Okay.
So turn taking, sharing, you know, these are, you know, difficult for children on the spectrum.
Okay.
The other things too are uncommon interests. So they'll have a particular interest or obsession in specific things. Yeah,
because I noticed like with children who do have like they fixate on a certain interest, but the fixation is almost like would positive be the right word for it? Because they learn about this special subject or this special interest that they have, and they become absolutely like amazing.
Yeah.
And you can get a 5 or 6 year old that will tell you things about like trains, for example, that will make you just want to sit there and just listen to them.
Yeah, absolutely.
You know,
absolutely. I've come across children that are able to name every single train station.
Yeah.
And I'll drop them in, I don't know, Windsor or something like that, and I'll be like, give me the 5 train stations on either end, and they're able to do it. For example, I don't even know if Windsor has a train station.
But you know what I've noticed though, like a fair few children that I like over the years that I have met have had a fascination with trains. Like, is there something about trains?
I don't know. It's definitely a recurring theme.
Yeah.
But it's not specifically around trains.
Okay.
Yeah.
But is there something about trains that caters to their cognitive state or their neurological state?
Yeah, it's a good question. I mean, the closest that I can answer to you is just, again, it's depending on who's presenting, right?
Okay.
Like boys are more inclined to a certain extent.
Yep.
Men are more inclined towards things. Women are more inclined towards people.
Yeah.
And caring and nurturing and whatnot.
Yeah.
So that could be a factor in it.
Yeah.
That they're interested in planes, interested in trains, whatever it may be.
Okay, cool.
Yeah. But that's not to say they're only interested in these sort of things.
Mm-hmm.
Like Paw Patrol is a massive one that keeps popping up.
Oh, yeah.
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 But just because they have interests, it doesn't mean that they're on the spectrum. Again, there's a whole battery of tests that we do for a child to be diagnosed with being on the spectrum. Yeah. So it's not as simple as, histamine, for example, or special interests or not being able to play.
Okay.
Yeah.
And so when it comes to children who have like whether it be anxiety or depression or whether they is it important to have these symptoms these conditions diagnosed early so that they can be treated, and like what role should parents play in facilitating that? And the reason why I'm asking is because you'll get different, how like for example children present differently, like adults and parents, they present differently as well. Like you'll get parents that for whatever reason, whether it be cultural, there might be a shame factor associated with the fact that their children are presenting with something and they don't want to have them diagnosed, whether it's because they're ashamed or whether they're in denial. And then on the other end, you get parents that are like hypersensitive, or maybe not hypersensitive, but they're hyper aware, where they kind of like want to diagnose the children themselves, which could be a good thing or not, because they want to probably pick it up early. What do you say to that? Like,
the literature suggests early intervention is the best intervention. As soon as you can jump on it, you don't necessarily have to have a diagnosis for treatment.
Okay.
So to answer your question,
you mean by when you're saying you don't need to have a diagnosis for treatment,
right?
You're saying
like fundamentally, right?
As like in you don't need to take the child to a doctor or to a pediatrician to have them assessed. Is that what you mean?
No, let's pause here. I think it's very important because this is a big thing in psychology as to how we can go about accessing a psychologist.
Yep.
So once again, you don't need to know what's going on with your child. Yep. You can take him to the doctors.
Yep.
And the doctor should be doing their physical examination.
A GP?
Their mental, GP, yep. Absolutely.
So that's how the process would start?
Sure. Okay. Yeah, so make contact with your local GP.
Yep.
Or whatever GP you have around. They'll do their physical examinations, mental examinations.
Yep.
And then from there, you can get something called a mental health care plan, which your GP gives to you. And then from there, that's when you can access a psychologist.
Yep.
Now, once you're at the psychologist, then you can present the concerns. So in that whole process from beginning to seeing the psychologist, there might be emotional regulation issues.
Yep.
There might be some social skill. There might be anxiety. There might be depression.
Yep.
These are some things that we can flesh out in therapy.
Yep.
But a diagnosis, for example, saying, oh, my child is depressed.
Yep.
Or I'm certain they're anxious.
Yep.
That's not when...
Like a misdiagnosis, you mean?
Not necessarily misdiagnosis. What I'm trying to say is you don't need to know for certain what's going on to go see a psychologist.
Oh, okay.
Yeah, so you go to your GP.
Yep.
Have that conversation with them.
Yep.
And then you can go from there. So a diagnosis is not necessarily compulsory for treatment. Yeah.
Okay, cool. And once they have a mental
health care
plan, is it very, very easy to then get referred to a psychologist? Like, how does it work in your line of work? Like, do you get any of your referrals from mental health care plans from GPs?
Okay.
Is that how it works?
A very good question again. Now, there's multiple avenues to go see a psychologist. Now, you don't probably necessarily have to go get a mental health care plan. You can just go see a psychologist. So the referral pathways to go see a psychologist vary. So you can go, again, get a mental health care plan, which you get a rebate under Medicare. The other way is private, where you just skip the GP and you go straight to the psychologist. You don't get because you don't have the mental health care plan, you don't get a rebate there. This is private. More often than not, there should be some some GP involvement, at least when I'm doing therapy.
Yeah.
Some GP involvement. It's very important not only to focus on the psychological.
Yeah.
I come from a very holistic perspective.
Yep.
So it's not only important to be treating psychological attributes and domains, we need to be looking at also the physiological.
Yep.
And that's out of the scope of a psychologist, and that's where the GP comes in,
Yep.
or a pediatrician or whatnot.
Yep.
So mental health care plan's one way, accessing the psychologist privately is another, and then there's obviously the NDIS route.
Yeah.
Okay. To access the psych.
All right, cool. So like now, what are the benefits to the parents and to the children? Like we know that early intervention is important, but can you speak about some of the conditions that children present with, and just walk us along the pathway or the treatment plans? Or because I'm thinking to myself, okay, look, you've got a parent at home. They're really worried that their child is presenting with maybe anxiety, for example. They're very anxious. They don't want to go to school. I've heard of cases like of things like you were speaking about it before about selective mutism, for example. So like what is selective mutism, for example, and what's it connected to?
Yeah, like I need not necessarily have to be careful, but it's very subjective.
Yep.
And that's why it's hard to attack an example that's just like a
very
hypothetical.
Broad in general,
yeah, it's very broad in general. Yep. There's so many variables associated with therapy.
Yep.
The presenting problems.
Yep.
Precipitating, perpetuating, predisposing, and then obviously the protective factors. What these are basically fancy words for a case formulation. What a case formulation basically is predisposing factors. What are the factors, the genetic factors associated with what the child is presenting with, what the adolescent is presenting with? For example, adolescents who are anxious have a higher chance than children who aren't anxious to have anxious parents.
Okay.
So there could be a genetic disposition there.
Yeah.
Precipitating, perpetuating factors. What are the triggers? What are the maintaining factors going on? Presenting problems are obviously the problem that you come with to the therapy. For example, selective mutism, they're not talking in specific situations.
Yeah.
So then, based on this, a culmination of these factors that we put together, we can go through a treatment plan moving forward from there. And then last but not least is the protective factors. What are the things that are right now a protection towards the kid? Like what are the good things going on in their life, so to speak, their supports that are present in the kid's life.
And what are they? What would be some of them that we could talk about? Like
anything that's good.
Yep.
Anything that's good. Again, very subjective.
Family, sport.
Yeah. So my protective factors, for example, are BJJ, for example.
Yep.
My wife is a protective factor.
Yep.
Meaningful relationships,
Yep.
friends, protective factors.
Yep.
Things that help me.
Okay.
Yeah. So the reason why I'm bringing this up is because there's a formulation associated with all these, even the past examples associated with anxiety, depression, whatever it may be. There's so many variables that we have to take in consideration before moving forward as just, this is what we do.
Yeah.
Yeah.
Okay. And we were speaking before off the air about the role that parents play in treatment. So if what role do they play, and how important are they as a part of the process?
And I think this goes full loop back to what you were telling me initially.
Yeah.
And that's, what are the presenting problems that I'm seeing today?
Yeah.
And what I want to speak about is one that's very relatable is the way that parents are coaching their children through emotional challenges.
Yeah.
One way could be is, a very big program that I stick by, and I swear by, is the Circle of Security Parenting, which is a parenting program.
Yeah.
Around attachment, and we need to be available for our children, not only in the good times, but also in the bad, and that's where it's important. More often than not, sometimes, I'm not specifically talking about any parents that I'm seeing or any presentations that I'm seeing, but more often than not, what happens is when my child is sad, angry, depressed, feeling any sort of negative emotions, like I just want to shun them away and not care for them. So we're very happy when our child walks for the first time, when our child is laughing, when they're playing well, when they're doing well. But then what happens is sometimes when our child needs, or our adolescent needs their emotional cup to be filled, sometimes we're not available for that.
During these dark times?
During these dark times, absolutely. And they don't necessarily have to be dark times.
Yeah.
It could be when my child falls.
Or challenging.
Challenging, yeah. So part of this circle of security, for example, is being able to fill your child, adolescent's cup, emotional cup. And the way that we do that is we need to protect them. We need to show them that there's protection, that we delight in them, where we're able to organize their feelings, not and validate their emotions. And so more often than not, if you can just talk words of encouragement, get your child to understand, or your adolescent to understand, that you genuinely understand and that you're hearing them, and that there's unconditional positive regard in that. I understand where you're coming from. I'm listening to you, and we can tackle this problem together.
Yep.
You can work through anything, and generally the anxiety, the depression. I'm not saying again that this
in all cases. But it tends to help.
Helps absolutely. When you have your father, your mother, your caregiver, it's like, I've got you, kid. Let's go do it together. I mean, what more empowerment do you have?
And to know that you've got that kind of support.
Absolutely.
Well,
unconditional positive regard.
And are you saying that when parents naturally aren't aware of that?
Sure.
And it's not, obviously, it's not the fault. Maybe it's just habituation, because depending upon the culture or the upbringing that you've had.
Yeah, absolutely.
Maybe different parents, they kind of treat those situations differently.
Sure.
Like, you could get like some parents that would adopt a more negative, they would apply more negative reinforcement methods in those situations, where they'd be like, okay, if I'm gonna, if my son is getting upset about some sort of a challenge that he's coming home with, and I kind of speak to him about it and tell him that I'm going to be there, maybe I'm kind of giving in, or maybe I'm kind of like feeding this weakness. Is that a possibility that, like, it's not so much a possibility. I know that it's true. Like, I'm reflecting on
sure
not just maybe myself, but just people that I know, by which there was no room for kind of like open emotional dialogue. For example, between parents and children, like that just doesn't happen. And there are certain cultures that, in general, more so than not, that they don't do that.
Sure.
Is that true?
To a certain extent.
Yeah.
I mean, we didn't have to look far, like my Middle Eastern parents.
Yeah.
Maybe not a lack of their ability to talk about these emotions, for example.
Yeah.
But they just didn't. They didn't know any better.
Yeah.
You know what I mean? But also, it's very important to understand that, to a certain extent, you can only parent the way that you were parented.
Yeah.
So, for example, if we can get a little bit more concrete, is that on the circle of security, and for those that are watching, you can look up the circle of security, and you can see this map that I'm about to talk about.
Yeah.
And what this is going out and coming in, exploration and filling my cup.
Yeah.
Now, sometimes parents are very good. It doesn't necessarily. Well, let's run with this example. Some parents, when they were parented, right, their mothers, so if I'm a child, you're my father, and then my grandfather.
Yeah.
If at a time, for example, your father didn't support your exploration, and it's like, no, don't go out there. Don't go on the swing. Be careful.
Yep.
Don't explore the world. And created sort of an uncertainty or anxiety around your exploration. Yep. You're going to feed that back into your parenting too.
Okay.
And so, once it's time for me to go explore the world, exploration doesn't necessarily mean like this big expedition.
Yeah.
Like it could mean going out to the park and going on a swing.
A trip around the world. Yeah.
Absolutely. It could be going out to the swing.
Yep.
Or exploring a new room or something like that.
Yep. Or even taking on a sport or
absolutely.
Or a hobby.
Yeah, absolutely. And because your father was a little bit anxious about your exploration, he modeled that to you, and now you're going to model that to me.
Yeah.
It's like every time now I'm going to explore.
Yeah.
Well, you're going to tell me, no, kid, come back.
Mm-hmm.
Right? But then on the bottom of this circle is coming in and like filling my cup. So for example, when I'm on the swing, I'm all anxious, you're all anxious and stuff.
Yep.
And I fall. And like, now I need my dad. And so I run towards my dad.
Yep.
And so that's you welcoming me back in.
Yep.
And so you're really good at showing me your affection, because you're able to protect me. You're able to organize my emotions. It's going to be okay.
Mm-hmm.
It's all right. You know, giving me a hug, giving me a kiss.
Yep.
And so you're very good at me coming back in.
Yep.
And so the reason why I'm saying this, it can go the opposite way around. It's like we can support our children to go and explore. You can go out and explore the world, and you're able to fill that cup in that way. You know, you support my exploration. But then when I fall, and this sometimes happens with parents, I fall, it's like, oh no, not this emotion again. Oh, he's sad. He's angry.
Which is a habituated natural reaction.
In what way?
Be, in a way that like maybe they're not conscious of the fact that they're doing it.
Absolutely.
It's just very reactive.
It could be reactive.
Thoughtlessly reactive.
Sure.
Because I'm just saying that because like I'm guilty of that myself.
Mm-hmm.
But I'm aware.
Mm-hmm.
You know, like that sometimes like it'll be the third time that my son has, for example, cried in the day over something that I see as being trivial.
Sure.
And I want to be there emotionally for him.
Mm-hmm. Mm-hmm.
But just habitually, I'm like, come on, man, just like,
sure,
you just keep crying every time.
Absolutely.
Like, you just something happens to you, you know, like just stop crying, you know.
Right.
It's about being aware and just making what is so. It's
and so this
saying
is
that it's something that we need to, like, we as parents need to learn to fight against. To be like, no, you should be trying to fill his cup in every situation. Every time that happens.
Very, very good point. So what I'm trying to summarize is 10 weeks worth of intensive therapy.
Yep.
In a 5-minute discussion, okay. Right? There's a lot more that goes on.
Yeah.
A big part of this program, which is a circle of security that I run, is yes, it's about the child, but it's more so about the parent.
Yeah.
And looking introspectively.
Yeah.
Now you're looking introspectively and like, my emotional cup is empty, kid. How am I meant to give you now emotions, right?
You can't give what you don't have.
Yeah. Exactly
Okay.
right. Exactly
okay.
right. Yeah.
But is that where me as a parent, I'm supposed to reflect and say, I know that it's wrong. I need to find a way to fill that cup so that I can give it.
Nothing's wrong. There's no such thing as perfect parenting.
Yeah.
No one has it right.
Yeah.
Right. No. Yeah.
Yeah.
You just need to be good enough.
Okay.
And that's very subjective, right?
Yeah.
But there's no such thing as perfect parenting.
Yeah.
And so the first step into this is being aware.
Yeah.
It's like, hey, my emotional cup is empty.
Mm.
So when my kid is coming in, my son's coming in, for me to give him from my emotional cup,
yeah.
What am I doing?
Yeah.
And so you need to look introspectively and be like, well, how can I fill up my emotional cup?
Yeah.
But this is what I'm saying about that case formulation.
Yeah.
That it's a very big system, and it's really symbiotic together.
Yeah.
Like we're all different parts.
Yeah.
But we're all working together.
That's true.
Mm-hmm. Like
and
as dad, as mum, as kid.
Yeah. And so as part of this plan as well, you're saying that a lot of the time when you write up these programs or when you have these sessions or when you have this therapy, the parents need to be on board for like some of the reasons that you just gave now.
Yeah, attachment's very, very important.
And you said something interesting before about how when you are having sessions with children, for example, it's very important to speak to, for example, parents first.
Sure.
Is that when they're presenting with like anxiety or?
Yeah, a whole heap of array of reasons.
Yeah. And what's the reason why you need to get the parents on board and speak to them first? Like
so
you were telling me?
yeah, good question. Again, no simple answer.
Yeah.
First and foremost, a 6-year-old isn't going to tell me that I'm going to speak to well, maybe they might, but a 7-year-old, 8-year-old isn't going to tell me that I'm being bullied, for example.
Yeah.
And why if I sit down like a 7-year-old, hey kid, why are you here today? Tell me now. Like, do you know what I mean? Like, it's very hard for them to articulate what's going on. Now, they generally know what's going on. Like, they're smart. But the parents are able to give me further insight into what's going on.
Yeah.
That's first and foremost.
Mm-hmm.
Secondly, if it's anxiety, for example, there needs to be strategies from the parents' end. That's, again, in just like the circle of security, they're able to voluntarily expose their children towards a fearing stimuli, whatever that may be. That's first and foremost. But second of all, children are still developing in terms of emotions, right? Neurodevelopmentally, even from like a brain perspective, they need help for us to organize their emotions. And so I need the parents to co-facilitate that process.
Yep.
If a kid's feeling scared, if a kid's feeling upset,
Mm-hmm.
they need to be able to label that for their child. And not only does that give them that connectedness again, that attachment.
Yep.
I'm hearing you.
Mm-hmm.
I feel what you're feeling.
Mm-hmm.
I see what you're feeling. But it also organizes their emotions and in part, like neuropsychologically, it's doing something very important.
Yep.
And that's just settling in their brain.
Yep.
Hence the reason why a good way of going about it is if you're on the customer service line, for example,
Mm-hmm.
Let's say you're upset at a X telco,
Mm-hmm.
and they pick up the phone. You say your problem, and listen to this the next time they come around, and like that must be, it sounds like it's frustrating.
Yeah.
It sounds like it's annoying, and the reason for that is because it sort of dials down an important part of the brain, the amygdala, and it just sort of shuts that down. And what that part of the brain is responsible for is your fight or flight reaction.
Yeah.
Now with anxiety, that's what it is. It's fight, flight, or freeze.
Mm-hmm.
As a kid, you need your co-facilitator, your co-captain, to sort of organize your emotions in a way that can get your executive functioning part of your brain, which is your prefrontal cortex, to take over, and then you can settle down.
Yep.
But that process with the parents is very important. Emotional coaching, for those that want to look it up.
Yep.
The other thing too is sometimes the parents, God bless parents, they're absolutely beautiful.
Yep.
And they're always coming in for the right reason.
Mm-hmm.
Unintentionally, they might be reinforcing negative behaviors. So rescuing children. So he doesn't want to go to school in the morning. He's very anxious. That's fine. That's okay. And our ability to understand what they're going through and listen to what they're going through is first and foremost. Secondly, there's a positive feedback loop in what, especially in anxiety, if you keep avoiding the same thing that's making you scared, well, it increases the fear in itself.
Yeah.
Because you're avoiding it.
Yep.
Right? And hence the reason why at the very beginning of my discussion, it's voluntary exposure towards the fear.
In small increments?
Yes, in small increments.
So give me,
Mm-hmm.
I know that you don't like to generalize again, but like let's say, for example, we've got a kid who doesn't want to go to school.
Sure.
And he's anxious.
Mm-hmm.
Okay. What would the treatment involve, and how should the parent be thinking about how I can gradually help the child to be able to go to school and to at least be there and to be present? Because, okay, first of all, can you just like maybe say, is it bad to adopt you're going to school, I don't care, put them in the car, take them to school, they're kicking, they're screaming, they're angry, blah, 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 and then open the door, let them out, go to school?
Sure.
As opposed to the rescue method, you don't want to go to school, that's okay, we'll stay at home. Yeah.
Yeah. You've described
Both
two other
extremes.
ends of the spectrum a little bit.
So can you speak to both and then give us the...
Absolutely. Again, it's very difficult, but if I'm going to move away from therapy to a certain extent, I think the best way that I can paint it is for those avid Harry Potter fans that are out there. Even with, if we're going to think about Voldemort being this big, scary, evil person, right? Mm-hmm. To a certain extent, Harry Potter faced him in the first trial, right, in the Philosopher's Stone. But it wasn't the full person, right? So that's a step towards, the big dragon, the big evil person. So that's done. Then his second exposure was towards the diary, right? So that's, again, not Voldemort himself, but a sort of another incarnation of him, right?
Of him, yeah.
Sure. And then as we progress through the Harry Potter sequence, he starts to get presented with Voldemort in essence. He starts to fight him and
in
whatnot.
his truer form.
In his truer form, exactly. So J.K. Rowling done so well in breaking this down into
Yep.
something called somewhat a step ladder. And so she's breaking down this big dragon
Yep.
into smaller, digestible ways to go about that. Right, that's one component of
Yep.
how you can get you. It's very hard. Like, I don't want to comment directly on going to school.
Yep.
Because you need to break down school. Like, if they are going to go back to school, there needs to be steps.
Yep.
Right, and there's a whole variation of therapy around those particular steps.
Yep.
And there's a couple of, maybe up to 4 sessions before that until we start facing this big dragon of going back to school.
Okay.
One way that you can go about it is a gradual return to school plan. So you gradually go back to school.
Yeah.
But remember, it's voluntary exposure. That's the
important part.
That's
the kid
very,
needs
very
to,
important.
The child needs to want to face these incremental
Sure.
dragons.
Sure. Let's say, for example, these incremental dragons, or like smaller parts of the dragon.
Yep.
Yeah. It's the same thing with sleep. It's like, I'll sleep with you.
Mm-hmm.
Right? Your main goal is to sleep alone.
Mm-hmm.
Okay. Then you reverse engineer that to a certain extent. Okay.
Yep.
So this is exposure therapy, behavioral therapy.
Mm-hmm. So exposure therapy, because I was going to say,
Yep, it's
because I didn't want to make something up. I just
Sure.
I was thinking,
Yeah.
Is this a form of exposure therapy?
Right.
Yeah.
I'm being very careful as to the way that I'm lining this up,
Yep.
because I don't want this going out and then people trying this and be like, oh, psychology didn't work, and the rest of it. There's
that's the point of the disclaimer, I guess.
absolutely. So don't be doing.
Yeah, that's okay. We're just going to make sure that people that are listening,
Sure.
you're going to have to read the disclaimer in the YouTube video.
Yep.
Because this isn't a one size fits all.
Absolutely.
Yeah, okay.
Absolutely.
Yeah, keep going.
It's very important to consult
Yep.
a trained professional.
Yep.
But you want to be making this big situation into manageable, smaller chunks, and
Yep.
you can gradually move up the
Yep.
step ladder,
Mm-hmm.
right? And there's other things that are associated with this.
Yep.
Reframing of thoughts, whatever that may look like,
Mm-hmm.
regulation strategies, distress management, all these sort of strategies that
Yep.
are geared towards reducing your anxiety.
Yep.
To voluntarily expose yourself to these sort of things,
Mm-hmm.
and then moving towards that. So school's a complex one.
Yep.
Because I know we're talking about the parents' involvement in therapy.
Yep.
But as important as parents are,
Yep.
you need to be working alongside other stakeholders,
Like the school?
like the school,
Okay.
like the teacher,
Yep.
like the principal,
Yep.
learning diverse, school counsellor.
So it's important to make these people aware and to get them involved.
Obviously with consent.
Yep.
Some families are okay with it, some people aren't.
Yep.
And that's fine. There's always strategies and ways that we can mitigate those barriers there.
Yep.
But more often than not, I generally like to employ a team around me to make sure that we're all on the same page.
Okay.
We're all moving in the same way.
So it's important, for example, that if my daughter, for example, doesn't like going to school, she doesn't want to go to school, and then
Mhm.
I've implemented some form of a strategy or an exposure therapy to get her to go to school, it's important to make sure that her teacher's aware that she doesn't like school or that she doesn't want to go to school, or the principal, for example.
First and foremost, it's important that we see, like, again,
Yep.
I know I sound like a broken record,
Yep.
but we seek a professional and we don't do this on our own.
That's right, yeah.
There's generally a reason why she doesn't want to go to school.
Yep.
It's our jobs as to what's going on.
Yep.
Right? Maybe there's a million and one reasons
Yeah.
as to why. In my circumstance, it was me, it was that teacher, and then it was me, not performing
That's right.
well in my, my subjects.
Well, it's interesting though, because like when you're saying that, it's just like a thought that just came to my mind is because we're human, we're not robots, for example.
Mm-hmm.
And we've got souls, and it's just like we're such complex,
Absolutely.
rational animals. That's the reason why there are a million reasons, because it could be absolutely anything.
And
but it's funny though that even though there's a million reasons, the therapy is almost not the same,
mm-hmm.
but similar,
Mm-hmm.
and that the strategies,
Mm-hmm.
like this circle of
security
program, for example, can work
mm-hmm.
for some of these cases.
Mm-hmm.
Is that right?
Mm-hmm. Mm-hmm.
Which I find that fascinating.
Mm-hmm.
You know what I mean?
Because there's so many ways that you can attack, like,
Yeah.
the dragon, so
Yeah.
to speak. Yeah.
Yeah.
It's, absolutely.
Okay.
Absolutely.
One thing that you mentioned earlier, and I don't know whether you can speak to this, but what children find when they're younger is that they're exposed to the bully at school. Okay. or they are the bully.
Sure.
What role do parents play in helping their children to be able to develop certain strategies to be able to deal with the bully? Is it wrong to label this person as the bully? Is it like it can seem very simple to some parents, but it seems that it's probably a lot more complex than that. Yeah,
absolutely.
Have you had cases where children have had anxiety because they've been bullied at school? For
Definitely.
example?
The bully situation is complicated a lot. In that, the schooling system is set up in a way that doesn't necessarily favor anyone in terms of actions. You hit the kid, whether you're the bully or the person getting bullied, you hit them, you're suspended or expelled.
Yeah.
So there's like protection in either way sometimes in certain situations. If you ignore the behavior and the bully just keeps coming at you, it's like sort of a weaker target to a certain extent.
Yep.
So you need to be working again with the school within the parameters of what we're able to work with, and also with the kid that's being bullied, right? If you are a bullier, or
the one bullying,
the one bullying,
a bully. If you're the bully, yeah.
If you're the bully,
yeah,
or the one being bullied,
yeah.
Why are you doing that? Like, what is it? What do you? Again, it's to a certain extent, because I want to wrap this to previous parts of the podcast. Is, am I seeing my dad? Or am I seeing my mum? The only time they communicate is when my dad bullies my mum, for example. And so the way that I'm going to get attention at school is when I bully.
Yeah.
Or the only time that I get attention is when I bully or when I say these bad things.
Yeah.
Right? If I'm being bullied, well, what can I be doing as the person being bullied to sort of mitigate that problem also?
Yeah.
Now that changes from kid to kid, right?
Yeah.
Some kids, whatever. Like, again, it's a temperament thing. Some kids are very disagreeable and they'll stand up to the bully, and some kids are very agreeable and they want to walk away from the bully, or they just don't want to make anybody upset.
Yeah.
So it's working in with the parameters of what the child likes to do or is comfortable doing. Again, voluntary exposure.
Yeah.
And then working with their support networks to see what the best way of going about it is, and going from there.
Would you say that, let's say, if I have a child that's being bullied at school, would you say it's good advice for me to approach the other parent in a positive way and, I don't know, somehow start a conversation and just see whether we can work together to be able to like create some sort of a good result or a good outcome between our children? Or is there too much at stake there?
Again, it's a case-by-case scenario. It depends on what sort of bullying is going on.
Okay.
Like this, like for example, a victim and an abuser, and getting them in the same room. It's like, hey, let's get both parents of the abuser and the victim, and let's see if we can mitigate the situation. I was like, hey, you've just sat the people that are just, it's a victim and an abuser.
But you know what's funny about what you're just saying? That reminds me of something. At the school that I used to work at, they had this system that they called restorative justice.
Sure.
Have you heard of it?
Absolutely.
That's what it sounds like.
Sure.
And apparently, like, they swore by it. And I don't know whether they applied it properly.
Sure.
But they said that in a city, and I'll just explain my understanding of what restorative justice is. It's this philosophy whereby in any situation in which there's a perpetrator and a victim, there's a relationship that's been broken, and it's not just one relationship; it's multiple. So, for example, the relationship between obviously the perpetrator and the victim, obviously the relationship or the association that the child has between himself and going to school, with the teachers, with the parents, everybody gets involved in this, okay? And so restorative justice is a method whereby you get all the parties that have all the stakeholders that have been affected or that are impacted or that have some form of responsibility in the situation, and you get them all together.
Sure.
And you get them to try to kind of talk it out and to try to restore, which is the where the whole restorative justice side of things comes, in order to kind of restore those relationships and to make things better again. Is that right? No, and you're telling me that's
no, I'm not.
Sometimes that can be
Sure. Like, what I'm trying to say is, and throughout our conversation is, again, not one shoe fits all.
Yeah.
Sometimes restore, like, again, that process there might help.
Yep.
Right. In some situations, it doesn't.
Okay.
The reason being is because when I'm working individually with the child,
Yep.
adolescent, client, remember, it's voluntary exposure.
Yeah. Oh,
And
that's right.
You're taking away control from the kid.
Yeah.
You're taking, like, the bully's already taking control away
Yeah.
from him or her.
Yep.
You know? And that's probably like, and then you're telling, what happens if your daughter comes back, for example, your son comes back, it's like, I don't want to see this bully, Dad.
Yep.
It's like, no, you're sitting down.
Yep.
And you're going.
Yep.
And it's like, well, let's go back to the circle of security.
Yep.
And it's like filling my cup.
Yep.
Are you protecting me?
Yep. No.
Are you hearing me?
No.
Are you validating my emotions?
Yeah. And that's a bad thing, eh?
Well, if someone's not hearing you,
Yeah.
and like you're in dire circumstances and screaming for help,
Yep.
I'm like, swim.
Yep.
Like, I can't swim.
Yep.
No, you're gonna swim.
Yep.
I'm like, okay.
Okay.
No, swim.
Okay.
I mean, how does that make you feel?
Yeah. Especially someone who's like very, very anxious, and someone who's been hurt, or someone who's got a lot at stake, or in a situation like this. Is that right? Yeah. Well. Yeah, that's interesting, because I'm just reflecting on situations like that, and sometimes the teacher was the victim in some of these situations where the student was picking on the teacher,
right,
or had done something really bad to the teacher.
Sure.
And the teacher felt very what's the word for it? The teacher felt very unsupported by the fact that she or he felt that they had to be in the same room as the student, and they had to, against her will and against her wanting to, be in a situation in which they had to kind of like come to some form of a forced
Now
agreement.
again, and going back again to the amygdala and the prefrontal cortex.
Yep.
Now the amygdala being again from a neurological perspective.
Yep.
Your amygdala is firing. Your fight and flight response is firing.
Yep.
Now once that's firing in a hijack, so let me explain this very quickly.
Yep.
Murder committed in the moment and premeditated murder, if I'm not wrong, you can correct me, both serve different servings in jail. Like if you're premeditated,
manslaughter and murder.
Yeah. Okay.
Because one's intentional and the other one's not.
Correct.
Yep.
Now, something called the amygdala hijack, when someone commits murder in rage, it's a very primitive part of the brain, right? And they've just acted on that impulse.
Yep.
During that time, the prefrontal cortex, which is responsible for your executive function, like even more about the consequences of your actions, which is very important.
Yep.
The amygdala hijacks the brain, and you're not really thinking about consequences. Your body's in a fight or flight response. It wants to get away. It wants to neutralize the threat in any way, shape, or form. While that's going on, your prefrontal cortex, which is your executive functioning, your ability to organize, your ability to problem solve, your ability to see emotion, is switched off. Because how you need to get out of there. It's a life-threatening situation.
Yep.
It's interested in defending yourself.
Yep.
When you have this victim, for example, and not necessarily, I'm using the word victim very loosely over here, right?
Yeah.
But when you're putting someone in a room, right, against their will, because they're anxious, for example, that part of the brain there is firing. It wants to get out.
Yeah.
While that part of the brain wants to telling you get out, your prefrontal cortex, so your ability to problem solve, isn't active.
It's damaged.
Well, not necessarily damaged,
but it's inhibited.
It's not communicating as well as it should be in the moment, right? So you're asking this victim, give me ways that you can move forward. We can move forward. So, hang on, my body's processing getting out of here, and you're telling me to process something. There's a conflict in my brain going on.
Yeah.
So, again, I'm not saying this process doesn't work.
Yeah.
But it needs to be in a way that the person who is anxious, like there needs to be individual recommendations
and
strategies.
recognition of their
Absolutely,
of their states.
absolutely. And the reason why I'm talking about this is because the person who's commits murder in the act, like it's impulsive.
Yeah.
You know, it's out of rage. It's out of fight.
Yeah.
The premeditated person, he's used his prefrontal cortex,
Yeah.
the human part of the brain.
Yeah.
See at your forehead. And so he's premeditated that. There was a plan intact.
Yep.
And so, again, when you put the victim and the person in the same room, and this person wants to get out, they're not thinking the right way. And so, I mean, is that restorative? In that situation.
Yeah. No, you're right.
Mm-hmm.
Okay, cool. And
so that's why I'm saying it's a base by base.
It's a case by case scenario.
Yeah,
okay.
Yeah.
Very good. No, because what I'm getting from this is that cases are so unique and so different that you can't just have some sort of a blanket rule that you go by. But it's very important for people to understand that you need to be aware of what's going on, and then I guess seek professional help, whether it be for your child or And so, in your experience, what role would you see faith or values play in treatment plans for children that present with a variety of these conditions?
Brilliant question. What faith does, and you basically hit it on the head, is it gives you a set of values you're able to operate in the world in.
Yep.
Cognitive behavioral therapy, which is a form of therapy. Acceptance commitment therapy, which is also another form of therapy. Both have some component of values embedded in them. So it's a framework that you want to be operating in. And so it gives you a criteria as to what you want to be going, or what you would like to do. Okay?
So what was it? Acceptance
commitment therapy.
Can you just give me a little bit of what that is?
Sure. Look, it's based on acceptance commitment therapy is a way of accepting the thoughts that come in. And sort of the best analogy that I can give you is this. It's just like water. You know. Cognitive behavioral therapy is a matter of recognizing unrealistic worried thoughts.
Yep.
Looking at the facts, whatever they may be, and converting that unrealistic worried thought to a realistic, calm thought.
Okay.
So you're sort of challenging the thoughts there to a certain extent. Acceptance commitment therapy is if you see a flower, or let's say like a leaf on a river, and there's a rock. And so what happens is acceptance commitment therapy is accepting what's going on. And then, so this is the leaf on the river, and then there's a rock, and it's just going around. It's like, I recognize this thought. Okay, we're going to leave it there.
And I'm just going to go around it.
Yeah, it's just being mindful of what's going on and just accepting things.
Okay. And then what? And then
no, it's not radical acceptance.
Yep.
That's very important.
Yep.
So it's not like I'm accepting everything that's going on.
Yep.
But then, what values does is it gives you a criteria, a framework to operate in the world. So, for example, if one of my values is, I don't know, give me one of your values.
Values?
Yes.
That I can't just say what I think because I don't want to hurt somebody's feelings.
Sure.
And I need to always be aware of that.
Sure.
That's
because
I need to respect the dignity of the individual that I'm dealing with. Or every person that crosses my path is made in the image and likeness of God, and then I have to be consciously aware that I need to treat them like that. Or following the golden rule, for example, to do to others, like treat others the way that you want to be treated. Good. Is that something for you to work with?
Absolutely. And so that's giving you a framework in the world that you want to operate in. And so if you deviate away from these values, it's like, well, I've done not necessarily something wrong, but I've deviated from the person that I want to be.
Yep.
Right? It's the whole, again, it's going back to what separates a villain from a hero.
Yep.
It's their values, right?
Yep.
And so they're both fighting for a cause, whatever that cause may be.
Yep.
The villain's fighting for his values and his causes.
Yep.
The hero's fighting for his values and his causes.
Yep.
And that forms the person that they are today.
Yep.
Right? And so if one of them is, I want to treat other people the way that I want to be treated, let's go back to the bully situation.
Yep.
So if this bully, for example,
yep,
has those values, is he more likely to be a bully or less of a bully? if
Yeah.
he was to live by that value.
I'm guessing it's like if you were to like for example speak or have therapy sessions with the bully,
Sure.
it'd be easier. Is that what you're trying
Correct.
to say? That it'd be easier for you to kind of like speak
Correct.
to a common quality or a common value.
Absolutely.
Yeah,
So for
okay.
example, it doesn't necessarily mean, like, again, with Christian faith, or
Yep.
Muslim faith, whatever it may be,
Mm-hmm.
there's values already embedded in the faith.
Yeah.
And so these are protective factors. We're going back full loop to the beginning of the podcast.
Yep.
Where these protective factors are these things that I want to live by.
Yep.
It's like, are you living by them? Well, no.
Okay.
So how can we live by these things? And more often than not, they're beautiful values.
Yep.
Right? I mean, to a certain extent, if we strip, just for the example,
Yep.
if we strip the divinity of Christ
Mm-hmm.
and you follow just his teachings,
Yep.
these are beautiful values to live by.
Yep.
Love thy neighbor as I have loved you.
Yep.
You can't love your neighbor to death.
Yep.
Right? Forgiveness, if
Yep.
this is a value that you live by.
Yep.
You know, it's accepting what's going on and then moving forward. Now,
Yep.
whatever that might look like for you, right?
Are you saying like taking up the cross, for example, like that whole sacrificial element?
Taking up your cross
Yep.
and moving forward.
Okay.
That's very, very important. And
And these are all. This is all part of acceptance.
no, not necessarily.
No.
But it could be. It could be ways. Now, obviously, we need to cater for, like, you can't tell a 6-year-old kiddo, carry your carry your cross, kid. Let's go.
Okay.
You know what I mean?
Yeah.
But absolutely.
Yeah.
Voluntarily shouldering your responsibilities, your burdens. You know, it's like a Jordan Peterson sort of take, right?
Yep.
A little bit.
Mm-hmm.
There's you know, there's quality in that.
Yep.
And accepting what's going on. It's like
Yep.
you got two decisions.
Yep.
To become the victim and you sort of become resentful around the world.
Yep.
Or again, do you pick up your cross and despite everything going on,
Yep.
you still march through to become the person you want to be?
Now, in saying that though, do you have to look for the values in a person or ask them what their values are before you can start using some of these methods? Or and do they need to have values? I know that everybody has values, but like, do you need to be able to articulate them, or do they need to be able to articulate them to you in order for you to kind of like have something to work with?
No, again, therapy is not this mystical thing that,
Yep.
you know, like that I'm sheltering away from the audience and
Yep.
whatnot, but not necessarily.
Okay.
Like, they're brilliant to have around.
Yep.
But it's like, well, again, it's like, what do you want your life to look like in 5 years' time?
Mhm.
What's the person you want to be in 5 years' time, for example? These are all speaking to your values a little bit.
Yeah.
Like, I want to be whatever.
Mm-hmm.
I want to be a noble person. I want to be a faithful person. I want to be a successful person.
Yeah.
Okay, you want to be successful. How does success look like for you?
Yeah.
Boom, 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 boom.
Mhm.
Okay, you've given me reason 1, reason 2, reason 3, reason 4.
Yeah.
These are your values. So, okay, you've got your values. Are you acting in accordance with your values at the moment?
Yeah.
No. Does that mean you're going to reach the person you want to be in 5 years' time?
Mm-hmm.
Maybe. Or no?
Yep.
Absolutely not. Okay. So you're not acting in accordance with your values a little bit.
Yep.
So what's the person that you are going to become? And then it's like, oh, it's this person.
Mm-hmm.
Is that the person you want to be? It's
Yep.
like, no.
Okay.
And so now I'm talking a little bit about motivational interviewing
Yep.
a little bit. But what we're trying to draw up again is the person. It's a heaven and a hell.
Yep.
You want to aim for a heaven.
Yep.
And you want to run away from a hell.
Yep.
And so
that heaven could be the ideal person that you want to be in 5 years' time, or
whatever it may be.
Whatever that is.
Whatever that may be.
For the individual.
It's the acclamation of what you want to a certain extent. Like,
Yep.
yeah. It's like the combination of, like, again, I'm drawing this from Peterson a little bit.
Yeah.
It's the combination, like, a God doesn't necessarily have to be the God that we believe in, right?
Yeah.
A God could be the combination of things that you want.
Yeah.
Right? So the greater good, for example.
Yeah.
Don't steal, forgive, you know, what I'm obviously reciting
Yeah.
Catholic values, but that can be the God that you
Yep.
adore.
Yeah.
And so that's the spirit that guides you to a
Yep.
certain extent, and those are the values.
Yep.
So to answer your questions, it's a protective factor.
Yep.
If it's a framework that it's already existing with the person, the client, the family, they're happy to work with it.
Yep.
It's most certainly something that I'm happy to work with.
Okay.
If it's not there, well, it's not a dire circumstance either.
Yep.
Do we need them? That's a good question.
Mm-hmm.
Do we need them? I think everybody, like from what I've seen, most children already have their values set.
Yeah.
I'll tell you how. They generally look towards a hero.
Yeah.
They'll generally look to Superman.
Yeah.
They'll generally look to Batman.
Mm-hmm.
And encompassed in those heroes are their values.
Yeah.
It's like the archetypes.
Yep.
And then you draw that from there. So
Yep.
yeah.
Like being brave, fighting against injustice, defending people,
Sure.
defending the innocent, the weak.
Sure.
That sacrificial element as well.
Sure. And look at the hero in all these stories.
Yeah.
Voluntarily taking up their cross.
Yeah.
Voluntarily sacrificing.
Yeah.
And they meet their paradise.
Yeah.
To a certain extent, right?
Taking upon the sins or the burdens of the people, voluntarily, kind of like sacrificing themselves for the good of others without having to, and being innocent of it. Yeah, I find that they all follow like that one archetype.
Perfect archetype, right? A little bit like again, Harry Potter.
But it's good that these children have heroes, and I guess for you as a therapist, it would help, I guess.
Mm-hmm.
Yeah.
Mm-hmm. Because their language is play to a certain extent, right?
Yeah.
Yeah.
And isn't it good for them to be able to have heroes that they look up to? Like, won't it help their character development?
Absolutely. A hero, a role model.
Yep.
Yeah. Absolutely.
Okay.
And so, again, you need to be shooting towards something.
Okay. Awesome.
There needs to be something.
Yeah.
And encompassed in these heroes and these archetypes are these values.
Yeah.
And these values are what's making these people.
Yeah. Wow.
And it's all, again, voluntarily taking up your cross.
Yeah.
Moving towards the sacrifice.
Wow.
Mm-hmm.
Awesome. Well, thanks very much
Thank you
for being with us. That was intense.
Yes.
And I guess I'm going to wait until people give me some comments in the YouTube channel to see whether there was something that we spoke about that they would like to hear more of, or that what we missed out on, and then we'll keep going and we'll do a part 2 if you like.
Absolutely. And again, I know I jumped from topic to topic very quickly and just giving general questions, general answers, and the reason being is because it seems like it's the theme of this conversation. There's no shoe fits all.
Yeah, that's right.
But yeah,
awesome.
I really appreciate it.
No problem. Thanks very much.
Done.
God bless.
God bless you too.